welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschenauer, the health officer at the Kanawha-Charleston Health Department. Today we're going to talk about a very important subject that affects our student athletes, concussions. This week, Kanawha-Charleston Health Department, along with our partners, the Kanawha County Commission, the City of Charleston, and the Kanawha County Emergency Ambulance Authority, hosted a concussion discussion at the Civic Center in Charleston. And today on our show, we have a very special guest who is one of our speakers. I'd like to introduce Dr. Jim Kyle. Jim, tell us a little bit about yourself.
Well, thank you. Good to see you again. I want to shake your hand on coming up with that term, concussion discussion. It really had a ring to it, didn't it? And we had, I would say, 50 or 60 educators, coaches, administrators present in the center there, and I think they had a good presentation, don't you?
Yes.
Yeah, I'm an emergency medicine physician and a EMS director and a sports medicine guy. We're living in Lewisburg now, where I'm in charge of Region 1 as a medical director for the West Virginia Office of EMS. We also do telemedicine and some concussion care through telemedicine, and we're very active in research and development of emergency preparedness for sporting venues.
Mm-hmm. Excellent. So you've had a lot of experience in this field. Why are concussions a problem? What has been going on in America today, particularly with high school athletes?
Well, concussions have always been an issue. The game of football, contact and collision sport, concussions and catastrophic concussion injuries have been happening for years. But what's different about this year, in 2024, for high school athletes, eight athletes, high school athletes, have died in the last month in our country. 8. The first one happened on August the 5th in Virginia, just a little bit south of Richmond and Hopewell, Virginia. The last one happened in the panhandle of Florida last Friday night. Both of those seem to be cardiac in nature. But what happened in the state of West Virginia, and actually what happened in our country on August the 24th, a little over 2 weeks ago, not one, but 2 high school athletes died of head injuries. The injuries occurred the day before. They survived only 24 hours. Mm-hmm. That's bad, Dr. Eschenauer.
It's very tragic loss, and it's brought a lot of attention to concussions. So as we look at the problem, we know that we've had a concussion issue problem, not just in football, where about half of student-athlete concussions occur, but also in other sports, whether it's girls basketball, soccer, boys basketball, lacrosse,
girls soccer
rugby.
Is number two, yeah.
Who would have thought that girls soccer would be number 2 for student-athlete concussions in America?
And that's data that's been distributed by a group called the National Federation of High School Sports. And I think that's 21-22 data for the concussions.
So we know we have an issue. We know we have a problem with concussions. What are some of the ways that we can prevent concussions moving forward in our student-athletes?
Well, I don't think we want to stop the sports. What do you think?
I don't think we want to stop the sports, but we do want to make it safer.
Well, there's been that call that maybe collision football, tackle football should not start until you're a high schooler. There's a lot of parts around the country are doing flag football up until high school level. But in terms of get back to your point, use all the resources that are there, and we've got a lot. Dr. Greg Elkins from Hamlin has led our state West Virginia Secondary School Activity Commission and its medical advisory board for many years. Also, the National Federation, chair physician. So we got a lot of information from the national, brought it to the state level. It's there on the Secondary Schools Activity website about proper tackling technique. You can't have an athlete participate without going through a heads-up video from the CDC. There's one there for parents. Know that information about proper technique, early symptoms of a concussion, and reporting it, and make sure that you play by the rules. That's the first step.
Yeah, yes, it is. And there's been a lot of attention on that at all levels of sports, professional and college as well, about proper tackling and much more severe penalties for those who don't tackle properly or lead with their head, targeting calls, etc. Let's talk about equipment for a minute. What are some of the advances in equipment that we have seen, and who's testing this equipment to show that these are legitimate tests and not just a company trying to push a more expensive product?
Are you talking about helmets?
That would probably be the biggest example.
The NFL, under the direction of Alan Sills, Dr. Sills, the Vanderbilt-based neurosurgeon who's now their chief medical officer, looks at helmets every year and rates them. Dr. Sills has been there 6 or 7 years. I think he took over in 2017. Some of the helmets he threw out, you couldn't wear. This year, they even went another step past which helmet's best in terms of the laboratory to position-specific helmets. One for the offensive lineman, one for the defensive lineman, one for the quarterback. Quarterbacks, for example, typically get a concussion not when they bump heads, but when they're tackled and hit the back of their head against the turf.
Yeah, these are, each of those players and positions do have different mechanisms of injury, thus the different helmet.
Yes, well, if an NFL player, there are 2,000 NFL football players. There are 1 million high school football players. If it's good enough, if the defensive lineman for the Chicago Bears deserves a great helmet, why doesn't an athlete at Greenbrier East deserve the same helmet?
Another issue that has come up is in West Virginia, we have some of the as good regulations and identification mechanisms in place by Secondary Schools Activities Commission for football players and sports across the board. Do you feel that there's underreporting of concussion and head injuries?
Well, what we talked about yesterday, I think we brought that out. And by the way, I want to mention that Dr. Greg Elkins' great leadership, he passed away unexpectedly in March of this year. And what I'm sure, imagine Joanne, his wife, will be watching this. She's helped all the travels we went to Indianapolis to do with the National Federation, and they're fanning. So Greg has done a marvelous job. And one of the guys he worked with for years in his Marshall connection and now at West Virginia Wesleyan is Dr. Dan Martin. Dan provided the data. Every high school concussion, every middle school concussion, by mandate and by law from the 2014 legislation, have to report each concussion. And the return to play protocol, and the return to learn protocol. What we saw from the data and we looked at yesterday at the concussion discussion, 70% of high schools are reporting and 25% of middle schools are reporting?
Only 25% of middle schools.
We've got to do something about that. Our state board of education needs to put down a little bit of a mandate. Let's fill out the forms. They're on the website. They're electronic.
One of the big issues that has been identified is the lack of athletic trainers, particularly here in West Virginia.
Yes. Did you see that slide yesterday?
Yes, I was there. I moderated the discussion, and
did it surprise you?
Not really. Oh. Not really. It did not, because I'd reviewed a lot of that data as a physician previously. But the concern has been that counties and or the state don't fund athletic trainers that could assist with both prevention and reporting. What might we recommend to the state as healthcare professionals that need to be done to improve the number of athletic trainers across our schools?
That's $1 million question. We've been trying to do this since the 1980s. Probably the best example, let's take a look at systems at work. We heard yesterday from Putnam County, what's been going on there. 10 years of an athletic trainer full-time, a certified athlete full-time at the school, and the great results. So I think we need to take advantage of that. At Ripley, you had an athletic trainer there. When your children participate in sports, correct?
Yes, we did. And Steve Lowe has done a great job there. And speaking with Dr. Tony Irwin out of Putnam County, it became a priority because it goes beyond concussions with an athletic trainer. Identifying early, especially orthopedic injuries, treatment, taking those players out of play to let them rest, heal, and have the proper amount of rehabilitation before going back into sports, especially contact sports.
Yes.
One of the issues that was brought up has always been financial issues and that there's not funding for athletic trainers. But we've also seen what happens when we don't prevent injuries across our country. We don't report injuries in an adequate manner, and we don't buy equipment that would prevent, not stop, but at least prevent or lessen the number of injuries. So I think this pie has many pieces to it.
Yes, it does. Not an easy solution.
No, it's not.
Doctor's not an easy solution.
But I think there are definitely things that we can start to do today for parents and educators, coaches, referees, umpires, to start reaching out to the legislators to say, sports in our community are important.
Safe sports play is important.
And we need to improve safety, and this is what it will take.
And
better equipment, athletic trainers, and accurate reporting so that we can prevent the tragedies like happened in Boone County this year.
Dr. Steve, we've got a wonderful foundation in our state. It's back to the Secondary Schools Activity and our close relationship with the National Federation of High Schools. Those red dots are not just our problem. They're countrywide.
Yes.
And the Corey Stringer Institute and the NFL are ready to help. With application, they will send the right type of resources into a state, into a location, to get rid of those red and make them green. You just got to reach out. We got to reach out and team up.
Yes, we do. Yes, we do. I think this discussion needs to go beyond the medical community and engage the entire education, coaching community, and our legislators and other funders to improve the safety for our student athletes.
Yes.
So, let's talk a little bit about recognition of concussions. There was a good bit of the talk yesterday with also with Dr. Calvin Whaley, a respected neurosurgeon from right here in Charleston, West Virginia. Tell me a little bit about recognition and why it is so important on the field for coaches, parents, teachers, and referees to recognize concussions and get those kids out of play.
Yeah. You know, way back when, we used to think it wasn't a concussion unless you were unconscious. You remember those days?
Oh, yes. Shake it off.
Yeah, and we had just catastrophic number of head injuries and neck injuries back in the 60s with the idea, point of the head into the shoulder pad and the numbers. Well, that's gone away. But as a team physician, sometimes, and I'm right there, Concord University, and I miss it. A concussion has occurred, and I didn't see it happen. But the athlete self-reporting saying, "Doc, I feel dizzy. I don't feel quite right. I feel foggy." And then, of course, on the ride back after the game, they've got light and noise sensitivity. It's really evident then. So early recognition is key, because if you miss it and they get another hit, the results could be catastrophic.
Yes, yes. It's so important to protect those athletes after an injury, for the coaches to report, for the actual athlete to report, to say, hey, I'm not quite right. Something is not feeling right.
Exactly.
Yes.
I'm not quite right. And that happened. Coach Garen Justice, who was at Concord University and took us to the semifinals in the NCAA Division II back in 14. He came over and said, "Doc, something's wrong with 85. He's missing his assignments." And sure enough, he's had a concussion.
Yeah, it's definitely an issue. So as we move forward, let's talk a little bit about you've got a little, can you hold that up there for us? The medical timeout.
Yes.
Yes.
The Friday night medical timeout.
So tell me a little bit about the Friday night medical timeout and why it's important for a team.
Yeah, we've had it in place now for over 10 years. Started in southern West Virginia, I think in 2013. As you know, I'm EMS medical director in that region.
Mm-hmm.
And you know from the slides, there are no athletic trainers in Region 1. So we had to make sure that we were ready on game night. So I went around to all the squads and went through the checklist. AED is not going to be very helpful on the sideline if it's locked up in the principal's office. What if you have to remove the face mask? Different helmets have different face mask removal tools, simple stuff like that. And it was launched, and it went from there to Atlanta, to Georgia, the next couple of years, and the Andrews Institute. Dr. Jim Andrews and his team down in Pensacola put a lot of emphasis on it, and it's grown. But this year, it's got a backside flip with QR codes for education. And we're very excited about that. We think equipment removal for suspected C-spine, concussion injuries, early recognition of, you know all about sudden cardiac arrest, Doc.
Oh, yes.
Yeah, and early recognition with eyes open and chest moving. So we want to make sure that's available to every EMS, every high school, every middle school in our state. If you're going to have a football contest next week or tonight, meet with the EMS, meet with the visiting and home sports medicine staff. Find out if you got a doc there, what their talents are, what equipment you have. Be prepared. Avoid chaos and confusion when an athlete goes down.
Very, very important. Yeah, I like a lot of what the Friday night medical timeout brings to the coaches. How do schools get this information?
The medical timeout?
Yes, sir.
Yeah, it's posted. It's posted on our website. It's posted on the Corey Stringer Institute website at the University of Kentucky. The SSAC has information on it, so just ask it and they get it. It's free.
Okay, so it's free. They don't have to pay for it.
Nope.
Nope. Excellent, excellent. So where do you see yourself moving forward in this discussion on concussions?
Well, we know the number roughly in high school football is 8% per year. Most of the concussions get better under 3 weeks. The younger the brain, not necessarily the faster the recovery. The younger the brain, the more potential for catastrophic consequences. After the first concussion in a year, Steve, the chances of getting a second concussion the same year is 3 times as much.
3 times the risk
Yes.
of a second concussion if you've had one
Right.
in the same year.
Yes, particularly in the younger athlete. So we just have to be honest about it. You've had a concussion. You've got to be returned to learn symptomatic in school before we even think about a return to play protocol. Mm-hmm. There's no way you're going to be playing high school football if you had a concussion today, next Friday, or the Friday after that. No way. Should you? There's a very talented concussion team at Huntington. There's a very talented concussion team in Charleston and in Morgantown with telemedicine capabilities. We can have the same type of care with a sports neurologist that is on the NFL's head and neck team. We can get every athlete in the state of West Virginia can get in touch with that person.
Yeah.
So we got to make it happen.
So we definitely have the resources.
Yes.
Let's talk a little bit about our other speaker. Unfortunately, he's not here today, Dr. Calvin Whaley.
Oh, my goodness. What a great
neurosurgeon.
job he did.
Yes. What were some of your key takeaways from his presentation?
Well, I'm going to ask that question back to you.
Oh, so
He said everything I could say and more.
yes, I think he really pointed out some really good points about how injurious some of these, or how traumatic some of these injuries can be.
Yes.
And why we really need to focus on preventing them so the patient does not wake up with a neurosurgeon looking at them.
Yes.
Probably the biggest key takeaway from all of that was prevention, prevention, prevention. And as you went on in your lecture talking about improvements to equipment, There's also been a huge discussion about guardian caps and its reduction.
Helmet guards, yes.
Yes, or a helmet guard. There's different
They've been
brands of
around
them.
3 or 4 years now. NFL, they've worked. NCAA, they work.
Yeah.
They work by meaning that this year, the NFL, in addition to preseason, all the athletes have to wear it throughout the season in practice.
Throughout the season
Yes.
in practice.
Yes.
And a little bit about reducing the amount of trauma to, or potential trauma to the head by reducing the amount of contact.
Mm-hmm.
That was another key point from your all's discussion that.
Yes, when we reached out to the NFL and NCAA leaders about these helmet guards, they said, Jim, they don't do the job. They don't prevent a concussion. What prevents the concussion is this decreases a bit of the impact, but you've got to limit the number of days you have contact in football. NFL and NCAA has. You've got to make sure that players self-report. You got to teach them. I don't feel right, Doc. I don't feel right, Coach. And you got to make sure coaches pay attention to all those videos out there on the websites about proper technique. All those things together, but the cap by himself won't do the job.
Yeah, I think they've definitely been shown to reduce concussions, and you can probably comment a little bit on the data from the NFL over the past couple of years. How much of a reduction has the NFL seen in their preseason with the addition of a helmet protective cover?
Yeah. Plus limited contact, plus kickoff rule changes, plus targeting. But it's been beautiful. Dr. Sills reports 50% reduction in the last 2 years. Also the better helmets.
Yep, so better helmets, a helmet cover that is protective, reducing contact, and some changes in the rules to prevent unnecessary collisions that would injure players.
Exactly.
All right. So at this time, I'd like to bring on our show Monica Mason. She is
Ms. Mason, good.
Is the director of our local ambulance agency here in Kanawha County.
And she's doing a very good job.
Yes. So at this time, we'll take a little pause and bring Monica Mason into our show.
Our family is no less than any other family.
My heart doesn't see race. Love is love.
All right, we are back, and we have the director of the Kanawha Emergency Ambulance Authority, Monica Mason. Monica, thank you, and welcome to the show.
Thank you, Dr. Eschenauer. It's a pleasure to be here. Dr. Cowell, good to see you again today.
Yes.
Absolutely. Yes. Great to be with you.
So we were all together yesterday.
Very early, by the way.
So we are all here after being at the concussion discussion yesterday, and one of the big issues that has come up after the concussion discussion is what is the phase 2? What is the next group of individuals that we really need to talk to about concussions, prevention, identification, safety equipment, treatment? And that would be our medical providers that are on the sidelines and or respond, both EMS personnel and, of course, emergency personnel in our emergency departments that receive these patients after they sustain a concussion.
Yes.
As well as pediatricians, neurologists. There's a lot to this. It's not just one entity that addresses and treats these patients. So, Monica, what is going to be phase 2 for the concussion discussion?
So, Kanawha County Emergency Ambulance Authority, in conjunction with the Kanawha-Charleston Health Department, we are planning our second training that will occur on October the 9th at the KCA's auditorium at 601 Brook Street. There will be additional information to follow based upon that, but Dr. Cowell is going to be joining us, and I heard you all mentioning Dr. Calvin Whaley. He will also be attending that as well. We're really excited to kind of dive into another phase of this and discuss how important this information and training is going to be to our emergency medical providers specifically. And there may be some other healthcare providers, like Dr. Eschenauer mentioned, attend, but we really want to gear this in towards our EMS providers.
So this is going to be truly a provider-centric discussion. So it's going to be a good bit different than
Yes, sir.
the discussion that we had for the coaches. And I think that's important to really dive into what medical personnel need to do both emergently at the scene, and as we talked a little bit about earlier, how to stabilize a patient, removal of equipment, and then evaluation.
That's a very important part. Now, I think in my part, I'm going to probably mention what to do with the collapsed athlete, not just in game day, but practice.
Yeah, absolutely.
Coaches, if an athlete collapses, does a face plant in any sport, what's your next response?
Yeah, I think
what are you
those are
thinking
very
about?
good points.
In addition to the head, which we worked on with the concussion discussion, neck, and heart.
Spinal injuries and cardiac issues that have resulted in a collapse.
Yes.
And as we know from the unfortunate deaths of student athletes this year, that several were due to cardiac causes.
First one and the last one were those 8. That's 8 already. Season's barely begun.
The tragedy that occurred this year in Boone County was indeed a tragedy. But it has also really brought to light the importance of preventing these tragic events in the future in our student athletes. And I think that this discussion that we're having about concussions, but also other medical issues, is so important for our community, coaches, staff, administrators, and our legislature. What we need to do to specifically get athletic trainers on these fields for practices as well as games.
Yeah, we've had 3 deaths in the last decade.
And then last, yeah.
A cardiac death in 2019 and another head injury in 13.
Very, very sad. And some of these may not have been preventable, but I'm sure that we can do a lot to prevent concussions in the future and other spinal injuries, but also all the orthopedic injuries that occur. Having that athletic trainer there that can help identify, treat, and know when to take that athlete out so that they don't have further injury.
Quick identification, get treatment followed up with. Absolutely, those are very good.
I think it's a public health issue.
Oh, absolutely, I do too, Doc.
I really do.
Well, it's definitely gotten a lot of people's attention, and I really am pleased to see how much interest that we've had from our entire community. Parents, kids, coaches, athletic directors, and our school administrators and legislators to address this issue and help our students. So I want to thank Dr. Jim Kyle and Dr. Calvin Whaley for doing a great concussion discussion this week. We're going to get that
It was a good
posted.
one, not a great.
It was great.
Thank you.
Yes.
You did a great job. You both did.
And I want to thank Monica Mason for taking this to the next level of sponsoring a training specifically for healthcare professionals. And will that information be posted on your website?
It'll be posted on our website. KCHD will make it available for them as well. This will be, again, another joint effort, just like this first discussion. And we'll share it with our other partners throughout the county and the city so that they can share it on their websites as well, too.
All right, awesome. I want to thank you very much.
Thank you for having me.
And I want to thank all of our listeners and viewers today for taking the time to listen to the importance of concussions.